Now I'm gonna talk about different techniques, that are out there. And it's not just for chiropractors. It's, there's other, therapists out there. Physical therapy is great. There's a lot of therapies that you can use to, to help yourself, facilitate that healing process. So I always say the first thing you do is you want to start with yourself. What can you do to help yourself? And if you're not reaching your goals, okay, maybe we need a little bit more assistance. And I'm going to kind of talk a little bit about, other forms of therapy. Chiropractic, obviously I'm a chiropractor. I've been doing this for 20 years. I love chiropractic. I can talk about this, all day long. Chiropractic is great. It helps, align the spine. It helps improve mobility in the joints. And the key component that I think gets overlooked with chiropractic, it actually helps with the function of the nervous system. Once your spine is aligned properly, your nervous system is working better, that also helps with the body's healing processes. So, I don't want to sound biased to chiropractic and talk all about chiropractic this whole time, but I want to just touch base that, there's a lot more to chiropractic than just, helping somebody with their neck or their low back. It's, if you go to a chiropractor that has a really strong philosophy, their philosophy should be, okay, I'm going to help you, with your body as a whole. And a lot of times, patients get apprehensive going to a chiropractor because they're afraid, of getting manually adjusted. Some people just don't like it. Not everybody was, wired to like a full forceful manual adjustment. And that was one of the things in practice that over the years that I kind of felt odd. I love manually adjusting patients. I feel there's a lot of benefits to it. But then I was like, there's just people that just don't like that. And I was like, well, what can we do to help these patients reach goals through chiropractic care by not just getting manually adjusted? And that's where, the beauty of chiropractic adjusting tools come into play. They're highly researched, highly effective. The key to them is they deliver a high-speed, low-force impulse into the spine that creates a certain response. And I'm going to throw some clinical terms out there, bear with me, but they stimulate a group of cells called mechanoreceptors. So when we look at the joints in our body, we have cells that are constantly firing. We have nociceptive cells that are firing, and we have mechanoreceptive cells that are firing. If we have more nociceptive cells firing than mechanoreceptive cells, the joints tend to be more irritated, inflamed, arthritic, painful. Adjusting tools are specifically designed to activate these mechanoreceptors. So when you're getting adjusted with an adjusting tool, we're not really using that to just put vertebrae back into place. That specific frequency that is developed with these adjusting tools activates these mechanoreceptors, and they're very beneficial. And to me, I was a little skeptical at first because I felt, I'm a chiropractor, I'm going to use my hands. And when I started incorporating it into my practice, I adjust everybody with an adjusting tool now. Mainly I'll do the manual stuff, but I'm using the adjusting tool in conjunction with it because I see the results of it. So, so if you're ever apprehensive going to a chiropractor because you don't want to get manually adjusted, call up the office that you're interested in going to and say, hey, does this chiropractor offer other techniques than just the traditional manual adjustment? Do they use adjusting tools? So don't be afraid that you just have to every time you go to chiropractor you have to get manually adjusted. Spinal decompression, it's gained a lot of momentum over the last 10, 15 years. And spinal decompression is geared toward patients mainly with disc herniations. And it's interesting, when we think about disc herniations, if we get diagnosed with a disc herniation, we think it's the end of the world. The fact of it is, say we did MRIs on everybody in this room, when we're not even paying attention to how much pain you're in. We're not looking at that. Half this room is going to have some type of a disc injury, whether it's a minor disc bulge or a disc herniation, and the other half of the room is not going to have that. So if you get diagnosed with a herniated disc or a bulging disc, don't feel like you have to run off and get surgery and it's the end of the world. There's a lot of people out here with herniated discs that won't even have a symptom from them. It's when these discs become symptomatic is when they become a problem, when people start to panic and like, oh my gosh, I have this herniated disc, I have to get surgery, I need to get this pain block, I need to get this medication. Take a step back. There's different tools out there that you can help with those symptoms from those herniated discs. And I started implementing spinal decompression into my practice about 12 years ago, and it's been a lifesaver. The amount of patients that that get relief with spinal decompression with herniated disc it's amazing. So not to say it's going to help everybody. Sometimes there are scenarios where people do need surgical intervention, but just don't think if you have a herniated disc it's the end of the world, because it's far from it. Massage techniques. When we think of massage, we just think of going to a massage therapist, which are great. I go to massage therapists once a month. We have them in our office, but there's different things that you can do to help yourself with massage also. There's just massage tools. We talked about stress reduction. If you get a massage tool, put it on your shoulders. Periodically, that's going to reduce those tensions the tension that's building up in your muscle, and can help reduce a lot of neck pain. And even from the chiropractic and the physical therapist perspective, there's even advancements in techniques that that we're being exposed to that we can implement into practice. One of the most common ones now is called Groston technique. It's actually a tool-assisted massage. It expedites the process of getting a massage. So instead of having to go if you don't have time to go for a massage, a hour massage, Groston can be facilitated within 2 to 3 minutes, and it's very effective in reducing adhesions and trigger points, or knots in your muscles. So explore different options for massage. But massage therapy is a great component to reducing muscles tension, but it also helps reduce stress. Cryotherapy, cold therapy, applying ice to an injured area. A lot of times I'll hear patients, yeah, my back was sore, I put heat on it. Why did you put heat on it? Well, it felt good. Okay, but unfortunately, sometimes what happens when you're applying heat, sure, it can get the muscles to relax, but especially if it's over an inflamed nerve or over your spinal cord, you can actually be increasing inflammation, and that could be the source of why you're actually having that pain. So for me, I've always been an advocate of cold therapy. Even just putting a cold pack on, 20 minutes on, hour off, 20 on, hour off. Do that a few times for a few days, and then you'd be surprised the results you can get from that. When I talk to patients about ice, they say, yeah, I put a cold pack on, it didn't do much. Well, how many times did you put it on that day? Yeah, once. Well, yeah, it's not really going to be that effective if you just put it on once or twice. It's using it 2-3 times a day over the course of time. That's where you're going to get your benefits from ice. One of the things I don't know if anybody's heard of it are the cryosaunas. Cryosaunas are pretty cool, no pun intended. But they reduce inflammation systemically. We actually have one in our practice. I know there was one downtown in Buffalo. I know there's a doctor in Orchard Park that has one, and they're starting to, I think there's even one in Depew and Lancaster now. So they're starting to gain momentum. I was first exposed to one at my chiropractic convention a few years ago, and I'm standing inside the cryosauna, and I'm thinking to myself, well, at first I was like, wow, this is pretty interesting. Maybe it's something I can incorporate in my practice. So I'm standing inside this, and after the first minute, I was like, wow, if I brought this to my practice, my patients are going to think I'm crazy. It's that intense. It's that cold. But when you come out of it, it's very invigorating. And when I walked out of the cryosauna, I was like, wow, there's something to this. My joints feel a little lighter. I feel like I was just revitalized just after being in this cold temperature for 3 minutes. So I started doing a little research on it, and eventually, I incorporated it into the practice. But I think cold therapy is overlooked a lot, and that's something that you can implement on your own. Yes.
Is that dry ice?
No, it actually is. No, he's inside of the chamber, and there's liquid nitrogen that gets converted into a vapor, and it's the vapor that's actually cold.
So roughly, what's the temperature?
You're at around negative 220 to 260. Yeah, and people ask me, how can you actually survive in that temperature? And I'm not going to sugarcoat it. It's cold. It's the coldest place in the world, essentially. But if you think about it, okay, when we're outside and it's negative 10 degrees, negative 15 degrees, and out here in Western New York, our head is exposed to that cold temperature, and we're breathing that in, and that's why negative 10 degrees, or anything cold feels that cold. But when you're inside the cryo sauna, your head is exposed to room temperature air, and you're breathing in, room temperature air. So it's cold. Your body's going to be cold, but physiologically, it's not going to have negative effects on the body because you're breathing in room temperature air, and you're only in it for 3 minutes. So I don't know how much time we have, but there's a lot of physiological changes that happen to the body, with being in the cryo sauna. I could talk about that for a whole hour, but I'm going to move along. But I just wanted to, the purpose of talking about it was to, let you know that there are a lot of options out there, to reducing pain and inflammation naturally. Cold laser therapy. Cold laser therapy is interesting, and I think you're going to start seeing a lot of this type of concept trending over the next 3, 5, 10, 15, 20 years in regards to pain management and tissue healing. It's one of those things that's kind of, people wonder how effective it is because you don't feel anything. Okay? Essentially, it's an infrared light that penetrates into the tissue, and it actually helps heal at the cellular level. And when I'm talking about like what you're going to start seeing over the next 3, 5, 10 years is there's going to be a lot more therapies out there that are healing at the cellular level. We ever watch some of these old sci-fi movies where somebody's injured and they lay on a table and somebody presses a button and they jump up and they're healed, and but I don't know if people get into sci-fi. I really don't, but you're gonna start to see that technology is going to make its way into the doctor's office, and it's going to help heal at that cellular level. So the cold laser, what that specifically does, it sends an infrared light into the cell, and inside of our cells, we have our mitochondria. Okay, that's like the powerhouse of the cell. And when that infrared light hits that mitochondria starts to produce more ATP, and that ATP essentially makes that cell healthier, more vibrant. And when we look at pathologies or illnesses, no matter what it is, whether it's a soft tissue or something with our heart or our digestive tract, we should look at what is the cellular health of that particular organ or that particular tissue. The healthier our cells are, the healthier we are as a human being. And healthier cells are actually fighting off or getting rid of unhealthy cells that are just taking up space and creating inflammation and and that are increasing pain in that area. So cold laser therapy is a great option to reduce, inflammation, but also heal at the cellular level. My last convention I was at, in our chiropractic convention, there were 3 different other therapies out there that are healing at the cellular level. And I go to my convention every year, and what I'm starting to see is, that's where the trend is. And what I always look for when I'm, obviously I'm going to research, different therapies, but I like to see which therapies are standing the test of time. Sure, anybody can say this is going to do this or this is going to do that, especially if you don't feel it, after one session. How do you know if it really works? But when you start to see these types of therapies making their way into these conventions year after year after year, to me that tells me there's some value to it, because people are actually utilizing it. That people are utilizing it, they're getting results. And so I've been going to my conventions since I can remember, but now it's pretty interesting that I'm starting to see a lot of these techniques that are healing at the cellular level. You might not be exposed to it now, but like I said, 3, 5, 10 years down the road, you're going to start to see more of these therapies being implemented through different doctors and physicians that you see. Neurooptimal. I brought the Neurooptimal unit into my practice a few years ago, mainly to help with stress reduction. The Neurooptimal is actually neurofeedback. Essentially, when you kind of sit in a relaxed environment or relaxed sitting, and there's an EEG unit that actually hooks up to your cranium that picks up like any aberrant firings, and it sends a signal to your brain to get your brain back on track into a more of a relaxed setting. So if you're under stress or you feel like you're trying everything you can, and stress is a component of your pain, Neurooptimal or neurofeedback could be an option. And again, this is another cutting edge technique that's starting to gain momentum in the health and wellness industry.